Does artificial disc replacement surgery require any follow-up procedures? Usually not, but sometimes yes. And it depends. Sometimes when we do a disc replacement for perhaps in the low back, there can be a small bone spur or a little tightening. And remember, the artificial disc increases motion. So if your disc was collapsed and not moving very well, and we cleared it and put an artificial in, you're going to move more. And if there's a small bone spur, it could rub the nerve and cause a little leg pain or irritation or arm pain perhaps. And sometimes we need to go shave that bone spur off. So sometimes you have to do that. It's pretty unusual, but it does happen. I mean, it's less than 2-3% of the time, but it does happen. As far as actual procedures at, we say, the index level or the level where the disc replacement was placed.